President Trump is looking at 6 changes to food stamps, one of which includes cutting benefits to millions. This is what the Republicans in Congress are working on right now to put in front of the president. I'm going to give you details of the significant changes that are coming to the SNAP program. And then a new Social Security law passed that is giving increases to seniors, and it's up to $1,100 a month in Social Security increase for millions of recipients. This law was just signed. I'm going to bring you details, and stay till the end of this video because there is news about stimulus checks. The IRS is getting ready to send stimulus checks to those who missed their checks from the previous rounds. I'm going to give you the timeline on when those checks are going to be sent by the IRS. If you're new to this channel, hit the like button, hit the subscribe button, because all we do is bring you the latest news and updates, anything in and out of Congress that's going to affect your Social Security, Medicare, Medicaid, food stamps, and more. So let's get right to it. Before I jump into this, I want to know where you're watching this from. So go into the comments and tell me your city and state. We like to know where our viewers are watching our videos from. So, should food stamps be cut? Well, Republican SNAP proposals could take away from millions of low-income individuals and families. So this is serious business, and I'm going to give you details about that. So the president is considering 6 proposals from the Republicans in Congress to change food stamps. Now, what is the backdrop to this? They're getting ready to implement or extend President Trump's big tax cuts that he passed in 2017. And part of that is they need to find the money from somewhere. And one of the places that they want to dig into is food stamps. And I'm going to talk about the specific cuts that are coming in a second. But let's look at all the changes that they're trying to make to the food stamps program. If you've been paying attention, back in the day, President Trump had this idea in 2019 of changing the food stamps program into a harvest box, at least a significant portion of it. And the way it was going to work is that instead of you having the ability to go and use your EBT card to buy food at the grocery store, you are now going to get a box from the government, and the government is going to pick what you're going to eat every month. And this idea was called the harvest box. And it met with strong opposition at the time because Democrats were in charge of Congress. And so they blocked this proposal. Now that the Republicans have the entire government, the House, the Senate, and the presidency, this idea of a harvest box is back in full swing. Let's talk about it. So Trump's new budget resurrects controversial harvest box proposals for food stamps as part of broader welfare reform. And this is no joke. Trump's past budgets have envisioned much more sweeping cuts. His last one proposed a nearly 30% cut to food stamps, including a new work requirement on top of those already in the program, and a plan to shift a big share of the program into a harvest box, a plan which household would not get to choose the food they buy, but instead be sent a monthly box of shelf-stable foods that the government picks. Now, the Republicans in Congress are in on this. Glenn Thompson, the Republican chair of the House Agricultural Committee, released his proposed farm bill in May. Its most striking provision would limit the ability of the Department of Agriculture to update its thrifty plan, upon which SNAP benefits are based. This would amount to a $30 billion cut over a decade, and its response to Biden administration's updating the thrifty food plan, which resulted in a nearly 30% hike in benefits. Now, let me give you a little background. So what happened was that there's a thrifty plan that determines the cost of increase, annual cost of increase in food stamps benefits. And it's supposed to help food stamps catch up with inflation. And over the years, that increase has been very slow. So historically, food stamp benefits have not caught up with inflation. What the Biden administration did, did a wholesale increase in the thrifty food plan. So back in 2020, 2021, you might have seen that there was a big increase in food stamps benefit, about 30%. Well, the Republicans are not happy about that. They want to roll back the Agriculture Department's ability to do the increases, and as part of that, implement this harvest box idea. Food stamps recipients, 75% of them are living at or below poverty, and 20% of them have no income. This 30 billion cut is going to cut deep, but more, even worse, the harvest box idea is going to impact a lot of people who are on dietary restrictions, who cannot eat certain foods, and they're going to get this box from the government or foods that some of them cannot even eat. So this is the first proposal that's in front of the president. The second one is the Republicans planning to make cuts to the benefits, and this is coming in various forms. I'll go into details about each specific cut, but here is a very summary of what's coming. Prominent Republican lawmakers and conservative think tanks have proposed cuts and other harmful policy changes to the SNAP program that could gain traction in Congress this year. These changes would cut food assistance across the U.S., making it harder for millions to buy the groceries they need to eat healthy food. Proposed harmful policy changes could cut food assistance across the U.S., and this is one of the things that a lot of people are worried about. Then there is this thing about junk food. Currently, nearly 23% of $25 billion of all SNAP purchases are spent on junk food. That's a lot of money. This includes soda, unhealthy snacks, candy, and desserts. The governor of Arkansas links these poor purchases to health issues like obesity, diabetes, heart disease, and hypertension. And so she's leading the charge to require the government to stop or discontinue the ability of SNAP recipients to use their food stamps to buy junk food. Now, here's one thing I'm going to say. When it comes to junk food, whether you agree with what she wants to be done or not, people on food stamps do not buy junk food in any higher percentage than people that are not on food stamps. There's been data, there's been research that has shown that people on food stamps don't spend their money on junk food any differently than the regular population. So that's something you need to think about. But this initiative is in full swing. And the fourth thing is cutting work requirements. They're determined to make sure that states that don't have work requirements or very strict work requirements are forced to implement much stricter work requirements on top of what is already there. SNAP already has work requirements that are very strict. If you have, if you don't have dependents, you can only get SNAP benefits for 3 months out of 3 years unless you're working or in an employment training program approved by your state. So this idea that people are not working who can work and have been collecting SNAP forever, especially adults without dependents, it's not true because you can only get it for 3 months within a 3-year period. And so work requirements are going to be tightened. And this is one of the things that we are reporting on because we're seeing a lot of news activity talking about proposals to increase work requirements for SNAP and Medicare, including for seniors. And this is where a lot of people don't really pay attention to the news and are missing out on the big picture here. They've been slowly increasing how old you have to be to continue to work to get SNAP. And now it's moved on to all the way to 59 years old, and they're trying to move it even further. So very soon, you may be eligible for Social Security at 62, and you may have to work to get SNAP at 62. That's where this is headed because it slowly has creeped up from 53 to 59 to now they're thinking about pushing it to 62 years old. And then states that have waivers that helped exempt certain groups of people from setting SNAP requirement, especially when COVID was around. Some of those waivers are still in place, and there's a move to get rid of all of that. So if you live in a state with high unemployment and you're on SNAP and you got a waiver, you are probably likely going to be able to, one, you're going to lose your benefits, but two, if you're not going to enroll in an approved employment program, you may not even be able to get back on benefits, especially with SNAP. So that is the news. Let me know what you think about it. And let's look at the specific proposal that President Trump and the GOP in Congress are considering to cut benefits. So this has been in the news, so I'm not going to bore you with it. And food pantries are stressed right now because they are the ones that are going to bear the brunt if millions lose their SNAP benefits because of these new cuts. So 42.2 million people were on SNAP as of August 2024. The government spent $112.8 billion in 2023, representing 68% of the USDA's budget, and 24% of consumer goods spending and 32% per person is what people are spending, is like the amount of impact that SNAP benefits have on spending. Food insecurity, however, is increasing. Only 86.5% of US households have food secure. So the other 13.5% are struggling. So Trump will likely pursue significant changes as part of a broad government spending to reduce, in part of the efforts to pass this tax cut is to find money anywhere they can find it. And key cabinet nominations, including Robert F. Kennedy Jr. for Health and Human Services and Brooke Rollins for USDA Secretary, who would oversee these cuts. Previous attempts in his first term, including revoking eligibility for 700,000 unemployed individuals, were met with stiff resistance, but now they'll be able to get it through. So what can you look forward to? Well, current regulations require able-bodied adults to work or participate in employment training programs with some exemptions determined at state level. Those state level exemptions are going to go away. Previous attempts to limit state flexibility in granting waivers for the 3-month benefit limit were blocked by the courts. Bipartisan support exists for specific expansion, including repealing the ban on individuals with felony records and addressing college student eligibility. Work requirements, while aimed at promoting self-sufficiency, can also create barriers from people receiving benefits. The Trump administration is expected to seek substantial spending reduction to offset proposed tax changes. Previous budget proposals in 2021 suggested cutting SNAP by $180 billion. That's 30% over 10 years. The current farm bill proposes a $30 billion cut over 10 years, and the Thrifty Plan, which I've told you about, is one of the areas they're going to try and do that. Fraud prevention remains a top priority, bipartisan, and a lot of people have been losing their SNAP benefits to fraud. Each dollar stolen through fraud cost SNAP $3.8 in 2023, up from $3.72 in 2022. And debate continues over SNAP. And so what's going to happen is that there's going to be this public debate about SNAP benefits, who should be on it, who shouldn't be on it, how long you should be on it, and whether seniors especially, what age can you be a senior and get SNAP without having to be required to have to work. That is part of what is coming. So I want to hear from you. Let me know what you think about these SNAP changes that are coming through President Trump, and which proposals do you think are fair, and which of them do you think are not fair? Are you on SNAP, and how are these changes that are coming up going to impact you? I want to hear from you in the comment section below. Now, let's talk about Medicare for a second before we move into the Social Security increase that I'm excited to talk to you about. So, Medicare has been in the news a lot lately, and I could not help but pay attention. Medicare Advantage customers face shrinking pool of insurers. Medicare Advantage customers should explore alternative coverage options before their plan is dropped. And then there's this news headline: 1 million plus patients lose coverage as insurers. Hospitals drop Medicare Advantage. Experts worry older patients could be exposed to catastrophic costs and interrupted access to care. And then this came out recently. 21 health insurance systems dropping Medicare Advantage plans in 2025. This is a big deal. And then they went on to list where this is happening, and it's all over the country that this is happening. And so for me, this was something that I wanted to look into and see what are the options for seniors who are being impacted by these Medicare Advantage changes. So the question is, why should you care? Well, first, the Medicare Advantage open enrollment season is now, but the window is closing. It's from January 1st to March 31st. And here's the thing: Medicare Advantage provides health coverage for half of the nation's older adults. So a lot of seniors are on Medicare Advantage, half. And the open enrollment is here, but here is the kicker. There are over 24,000 Medicare Advantage plans nationwide. That's why a lot of seniors don't know what to do, are confused, because there's so many choices, but then each comes with its own nuances that when you get into the details of it, it becomes overwhelming. That is why 90% of seniors are in the wrong Medicare Advantage plan. It's costing you money because the average couple, senior couple, spends over $300,000 in Medicare during their retirement. Plus, it's costing you your health because when you need coverage and you don't have it, that has consequences, negative consequences for you. So, during this period, during this open enrollment period, you can switch to a new plan. But there are 24,000 plans. How do you choose? Well, I have good news. I have been doing content for seniors for over 14 years now. We have multiple websites. We have 100,000 followers on TikTok. We have never recommended a Medicare partner because we never found the right one until now. Chapter, our new Medicare partner, is going to help you. And I'm going to give you 3 reasons why you should call them now. The first one is that remember the 24,000 Medicare plans that I talked about? Chapter is the only free, unbiased advisor that has access to all 24,000 plans. And you heard that right. They are the only provider with access to all 24,000 plans. So they can see everything and pick the plan that fits your needs. Not only that, their advisors, their licensed advisors, don't work for commission. So they are not there on the phone with you to recommend the most expensive plan because they want to get the most, the best commission. They are there to work with you one-on-one to align benefits to your needs. And then here's the best part. Seniors they've worked with have saved an average of $1,100 per year on average. That's a lot of money. So call them at 539-205-2147 or go to the description in this video. There is a link to a page that you can fill out a form and then they'll reach out to you. Now you have to act now because the window is closing on when you can switch to a better Medicare Advantage plan. And these guys are legit. I've researched them. That's why I am actually partnering with them because I've done the research and it's highly rated by the Better Business Bureau, A+ rating, and you can read their reviews online and it's all been great stuff. So call Chapter, get help on your Medicare Advantage plan while the window is still open. Now let's talk about Social Security increase. So a whole bunch of people are about to get increases to their Social Security benefits in this exciting law that was passed. The average person is going to get $360 increase per month, up to $1,190 for certain categories of people. So some people are going to see their Social Security benefits jump from $1,976 to $3,166. And there is back pay. Because of this law, the government is going to go back all the way to January 2024 and calculate back pay. And everybody that is eligible because of this law is going to get money. And it's for 12 months rolling back pay. So if you're getting an average of $360, that means that you're going to get at least $4,320. And some people are going to get up to $14,280. So what is this about? Well, President Biden signed, one of the last things he did in office was sign the Social Security Fairness Act. It's going to impact 3 million beneficiaries who will see their checks jump from at least $1,976 to at most $3,166 if you qualify. This has been a 40-year battle. It's going to cost $190 billion, and government workers are the beneficiaries of this. So how did this come about? There is a bipartisan support for this, overwhelming support from the House and the Senate, and the president signed it into law, the previous president. And now the Social Security Administration is getting ready to implement this law. It eliminates 40 years of WEP and GPO provisions that affected government workers. Major reform impacting over 3 million beneficiaries across the country. And here is how it began. In 1983, President Reagan passed a law that reformed Social Security. As part of that law, the original intent was to prevent double dipping by state and federal employees, state, local, and federal employees, which meant that if you were on Social Security, if you were paying into Social Security and you were paying into a government pension, you cannot get both, even if you've paid into both of them. And that has gone on for 40 years until Congress finally stepped in. First responders and teachers are impacted. State and local government workers are impacted. Spouses are impacted who who saw their benefits reduced by 2/3 because of this law, and so forth and so on. So, how much is at stake here? WEP increase is going to be $360 a month if you were impacted by WEP. That is how much you're going to get in addition to what you're getting currently. If you're a spouse that was impacted, you're going to get $700 a month increase. If you're a survivor that was impacted, you're going to get $1,190 increase in your monthly benefits. And then you're going to get the retroactive payments that I talked about multiplied by 12 for any of this, depending on what you are slated to get. So if you're getting WEP increase, your lump sum is going to be $4,320. If you're getting spousal increase, you're going to get $8,400 minimum. And if you're getting survival increase, survival benefits, your lump sum is going to be about $14,280. That is life changing for a lot of people. And this is something that has been going on for a long time. The Social Security Administration is getting ready to make changes to its systems to implement this. They're going to test their systems to make sure that they get this right. And then they're going to start sending out checks starting in February and March 2025. So you can call the SSA hotline if you have questions, or go online and you can learn more about this, or you can make an appointment with your local Social Security office and get some details about this. Now, a lot of people think that this was not fair. And a lot of seniors have written in my comments that this is not fair because they should have passed a law that increases Social Security for everybody, because a lot of seniors are struggling, and it would have been nice if there was an across-the-board Social Security increase. Now, there's something in the works. There are two senators right now, one Democratic, one Republican, that are proposing a Social Security increase. I'm going to talk about that in my next video. But let's address this WEP GPO issue. Here are voices of some people that were impacted by this, so they can hear from them. And then I can talk to you about, the whole issue of whether this was fair or not. This person says the government took $600 a month from me since 2009 from GPO. I have given over $100,000 since I retired. I will never recoup that amount of money. I won't be holding my breath for my money. That's the money she lost. Another person, some of us worked as firefighters, where, as I did not pay into Social Security, and then I also had a second job or a business where I did pay into Social Security. As a result, I earned enough credit to earn Social Security benefits. When I started receiving Social Security, I was initially told I would get X amount in Social Security. However, my first Social Security check was reduced by 60% because of my firefighter pension. Those of us that earn Social Security benefits in this way are the ones that will be getting the most because we were reduced the most. I am waiting to see if my February check will be increased by the $613 that my calculator shows. So this is the amount this person is likely to get in an increase because of this bill. Thank you for sharing your knowledge. I'm a person who is eligible for WEP repeal after 40 years in which both private and public sectors. At age 75, I am amazed I lived long enough to see the law repealed, and will be fortunate if I ever see a penny of the money I paid into Social Security, while I was also paying into a public pension fund, to go into my account before I leave this world. So there are real people behind this that have been waiting for a long time for this to happen. But let's talk about it. Is it fair? Should Congress have passed an increase, a Social Security increase across the board, in addition to doing this? Well, there is a case to be made there, because cost of living adjustment for this year was 2.5%. And that is not a lot of money. That's actually the low side when you compare it to the last 4 years. And a lot of seniors are struggling because a lot of costs has gone up. Medicare, Part B, premium increases, cost of drugs, transportation, rent, food, housing, everything has gone up and stayed up. So 2.5% increase, which is about $40 on average a month, got eaten up by Medicare Part B premiums anyway, which also went up by 6%. So when you pull all that together, there is a case to be made that this was not fair. At least not fair in the sense that those who got this deserve it, but the rest of the 90% of Social Security recipients that didn't get anything, how about them? Especially when you know that some people are going to get $360 or $700 or $1,190 and lump sum up to $14,000. That can be irritating to some people who are struggling and also need help. So let me know in the comments what you think about the Social Security Fairness Act. Do you think it was fair? Are you impacted? Are you going to get money? And let me hear from you in the comment section below. And also, let me hear from you where you're watching this video from. I want to know where our viewers are watching our video across the country. Now, let's talk about stimulus. Now, let me be clear. This IRS is about to send stimulus checks out to people who missed payments during those 3 seasons when stimulus checks were mailed. So let's talk about it. If you're new here, if you like what you're hearing, hit the like button, hit the subscribe button. I really appreciate your support as I bring you the latest news and update about your benefits. So, the IRS is about to send unclaimed tax credit to 1 million taxpayers. And so, who qualifies for this 1,400 IRS stimulus checks? Well, it's going to those people who did not get benefits or did not file taxes, and so they felt that they were not eligible for stimulus checks, or may have been told that they were not eligible, and now it turns out some of them are. And so the IRS is getting ready to send those checks to people starting in February, and it's been all over the news, and even on the IRS website you can see information about it. So the IRS announced a massive $2.4 billion stimulus payment program targeting 1 million Americans who missed their previous pandemic payments. This is not a new stimulus, but a recovery of missed payment. The money will automatically be deposited into bank accounts starting in January 2025. Recipients don't need to file any forms to the IRS. This initiative is specifically designed to catch those who missed their pandemic stimulus payment, particularly focusing on the 600 and 1400 rounds in 2020 and 2021. Payment distribution will be automatic based on IRS internal data review. They will identify who missed payments and send them the money directly. The IRS is conducting a comprehensive review of their internal data to find people who were eligible but never received their full stimulus payment during the pandemic. Target recipients are those who didn't file tax returns but were eligible for the recovery rebate credit in 2021. Many may not even know they qualify. Each eligible person will receive up to $1,400, which was the amount of the third stimulus payment authorized under the American Rescue Plan. Recipients will either get direct benefits, direct deposit, if the IRS has their bank information, or paper checks in the mail of their last known address. For 1,400 stimulus, you have to just simply wait. They will send it to you. Monitor your bank account to make sure that there are no surprises, because there could be surprises for you and there will be a happy one. So let me know what you think about the stimulus. Are you getting a stimulus check? Did you file taxes and didn't get one? Or did you not file taxes and thought you were not eligible and now you may be eligible? Let me know your thoughts in the comment section below. I want to hear from you. Until the next live, I thank you for hanging out tonight with me on this live, and I will see you tomorrow. Thank you.